vision. Improving life today. Inspiring progress tomorrow.
Mental illness. It's the most common cause of disability in the United States. According to the National Alliance for the Mentally Ill, nearly a quarter of North American adults suffer from a clinically diagnosable mental illness. Nearly half of them will have symptoms severe enough to interfere with their daily lives. The first step to overcoming a mental disorder is an accurate diagnosis. Doctors consider many factors when determining the cause of mental illness.
Some of the factors I consider when diagnosing a patient are symptomatology of the patient, how it fits in that particular patient, the history in that particular patient and the family history, the ongoing progression of the illness, what pattern does it fit, and the treatment response to the patient. Of course, we also consider other things such as information from family and friends.
While it's true some mental illnesses are chronic, effective treatments are available and can greatly improve a patient's quality of life.
There are many treatments available to people living with mental illness. These include medications such as antipsychotics, antidepressants, mood stabilizers, and anti-anxiety drugs.
Treatments have improved drastically. We have cognitive therapy, we have behavioral modification therapy, we have brief psychotherapy, many different forms of therapy now.
Through awareness and the persistent research efforts of those in the mental health profession, those suffering from mental disorders have never had more resources and more hope to overcome their illness. Dr. Ed Logue is a practicing psychiatrist in Birmingham, Alabama. As a clinician, researcher, and author, Dr. Logue specializes in the diagnosis and treatment of mental disorders. Dr. Logue knows the importance of education and public awareness to achieve appropriate treatment of mental illnesses. His new novel, Fly Me to the Moon, Bipolar Journey Through Mania and Depression, sends a heartwarming message to patients and clinicians that treatment is available. Dr. Logue's intriguing novel weaves facts about mental illness into the fictional life and story of Eileen Robbins as she struggles with bipolar disorder.
The reason I wrote this book is because so many patients ask for a book to read, particularly on bipolar. I wanted to be able to educate the people that want to know about the illness in a fun way. And so the novel is a way of having a fun story, but you weave in all the information that a person needs to know.
Dr. Logue is also the chairman of American Behavioral, an Alabama-based healthcare management company. American Behavioral concentrates solely on mental health as a carve-out from other healthcare companies. American Behavioral's great success is based on its people and innovative solutions to meet the needs of its companies and employees.
American Behavioral improves the lives of those with mental illness through very concerted, direct, personal interest. We do a complete treatment plan for the individual, and we work with that patient so that they implement that plan.
American Behavioral strives to become the best managed behavioral healthcare corporation in America. American Behavioral provides two basic product lines. One is employee assistance programs, and the other is managed behavioral healthcare services. And these integrate very well with one another to give a continuum of care for those that are seeking services.
As a loyal advocate for the mentally ill, Dr. Ed Logue and American Behavioral are helping conquer these common and debilitating conditions.
My plans for the future, of course, are to continue my clinical practice, my research activities, and to continue writing. I'm enjoying writing about mental illness and how people can understand it better, hopefully destigmatize it some, and improve the quality and parity of treatment. My book will influence the awareness of mental illness through being able to have people in the reading public actually be able to get into the mind and the lives of people with mental illness in a comfortable fashion.
American Behavioral has grown phenomenally over the years because I think we've always paid attention to our philosophy. The philosophy of American Behavioral is to provide responsive, ethical, and professional services in such a way that other corporations are proud to be associated with us. The future for American Behavioral looks extremely promising. We're just completing the process of creating what we call our goals and objectives, looking out over the next 3 to 5 years. And through that process, we can say pretty objectively, American Behavioral should achieve phenomenal growth in the next 3 to 5 years.